So again, like this, we call it point tick, point tick, point tick, like this. Okay, ready? Point tick. Okay. So this is one drop. So when you do one drop, if the patient's ear is really, the skin's too thin, or for any reasons you don't see the blood comes out as much as you want, there's another way to do that. Is when you want to open the can of a milk, when you open only one hole, when you want to put it out, you feel like the flow's not good, how do you do? Exactly. So adding the second hole totally helps. In one, in a way, you think, okay, what I'm doing is, see? That's how it is. How do you feel? Feel pain?